1, so here's Des Moines. And here's 2.
He's got him.
He's got him.
Yeah. Go ahead and talk to him one more time.
Oh, this is muted.
Table mics 1, 2, 3. Table mics 1, 2, 3.
Okay, they work. Make sure that it's pointed right at the speaker.
Yeah.
Yep.
I was going to say she's got a 240 area code.
Camera right. Camera right.
Camera right, mic 1, 2, 3. Camera right, microphone 1.
That's good. Thank
2.
you.
Camera left, microphone 1, 2, 3. Camera left, microphone.
He's got it. Thank you.
Excellent.
Podium mic is hot.
Hey. Yes. So should the governor just say something?
Somebody else new on the line, 0763. Thanks, Rob.
Okay.
Someone else just joined,
Okay, got it.
0233.
Thanks.
Yes, I'm David Pitt with the Associated Press.
Thanks, David.
Got it. I gotta go. Sorry.
Close to that other microphone on that somewhere.
Oh, on the other side?
Yeah.
Yeah. Oh, sure. Where's the mic? Oh, is it on the stand-up?
Yeah.
Kelsey. Oh, there's two.
Anywhere in this zone.
Yeah, perfect.
No, then yep. It has to do
A
that
little
because
bit
everybody
better.
wants to hear the question.
I know. Thanks for coming.
Yep.
Someone else on the line, 7637. Someone on the line, 7637.
Rachel with WOI.
Thanks, Rachel. Someone new, 8684.
Excuse me, Jared Strong at the Times Herald in Carroll.
Thanks, Jerry. New person on the line, 8573.
Yep, Clark.
He's with Iowa Capital, right?
Yes. Capital Dispatch.
10 minutes.
Who has the phone number ending in 6252?
Katerina Sestarek with Iowa Public Radio.
Thanks.
minutes.
That's what I'm curious. And not a map of the county, just like literally like a chart for all six.
Open the doors.
These stats for all six. Yes. Just, we're only gonna be up to full stats.
Someone else on the line?
The ones that are lucky enough to-
7050.
Yep.
Yeah, no, I understand that, but like. And also.
Do you have to put that in with KPRG TV9?
Put out to is trying to buy spare, buy like move the ones that aren't out there right now.
Those are two.
No, it's something with a ten. Like height. Yeah, well, see, without those, this, like.
Minutes.
She'll do the same thing. On the slide one. I just emailed this to you. Slides two.
One minute. $30.
Well, good morning. We'll go ahead and begin with an update on the numbers. So today we have 97 new positive cases for a total of 1,145 positive cases. We have one new county, Worth County, for a total of 79 counties. We have 1,151 negative cases today for a total of 12,821 negative cases. The state hygienic lab has the capacity to test 1,329 individuals. We have 122 hospitalized as of last evening, and we have 431 recovered, which is 38% of all of our positive cases. As COVID-19 cases continue to climb toward our peak, which is projected to happen later this month, we remain intently focused on our mitigation plan to protect the health of Iowans, ensure our healthcare system and workforce are stable and strong, and slow the spread of the virus to save lives. But we're also looking ahead to ensure the health of our economy. In the weeks to come, as we see our rates of positive cases and hospitalizations decrease over time, we'll begin dialing up our economic response efforts. Currently, we're leveraging state and federal assistance to provide much-needed relief to Iowa workers and businesses now and to help get them through this challenging time until we are fully open for business again. 2 weeks ago, we announced the Small Business Relief Program, a one-stop shop for Iowa businesses to seek assistance through tax deferral, including sales and withholding taxes, and grants to assist with short-term cash flow needs. Since then, the Iowa Department of Revenue has received 5,700 tax deferral applications and expects to approve another 2,300 this week while continuing to review the rest. All applicants in good standing with the Iowa Department of Revenue will be approved and notified by mail. When a deferral is granted, taxpayers will have 60 days from the original due date to pay their balance due. Penalties and interest will be waived for those 60 days. The application process remains open through April. The Small Business Relief Program grants were also in high demand. The Iowa Economic Development Authority received nearly 14,000 applications from Iowa businesses, requesting a total of more than $148 million in eligible assistance. Today, I'm expanding the program from its original $4 million to $24 million, which will be provided through the State Economic Emergency Fund and the Iowa Economic Development Authority. And I'm pleased to announce that the first round of funding will assist more than 500 restaurants, bars, breweries that have been impacted by COVID-19, by the COVID-19 pandemic. These businesses were among the first to close their normal operation, and it is our goal to get them back up and running as soon as possible. Here to provide some more information is the Director Durham, the Director of the Iowa Economic Development Authority. Debbie?
Well, thank you, Governor, and good morning to all. The health of Iowans has been in many of our prayers over the last several weeks, including my own, and there is no larger priority for our state. Also, I want to give a heartfelt thank you to our first responders, healthcare professionals, the homeless service providers who I had a conversation with yesterday, and our frontline workers for their expertise and commitment in assisting Iowans during these challenging days. Our team at the Iowa Economic Development Authority has been working tirelessly behind the scenes to assist as many of our small businesses as possible as they have closed their doors or have seen revenues dramatically drop. Actually, our team has spoken with or emailed with a large percentage of our small business owners from every industry sector and region of our state over the past couple of weeks. To our small business owners, we heard you. We heard every one of your stories about your family's businesses or your new venture. We heard it in your voice, we saw it in your detailed emails, and we witnessed it in your applications. I am here to assure you, judging by the thousands of emails and phone calls that we responded to, it reinforces what we already know. Our small businesses are the backbone of our communities, and we are working closely with the governor to leverage resources to assist as many of them as possible. So let's talk about the process. We received nearly 14,000 small business relief grant applications, as the governor stated, including at least 15 from every Iowa county. Every application received was triaged, and I use this word very purposefully. because triage actually describes this entire effort and this entire process. We determined eligibility, and the businesses identifying the greatest revenue disruption were awarded in this first round of funding that went out last evening. As a reminder, this program was designed to be short-term, stopgap funding until our federal resources became identified or available. The first round of the 503 email award notifications have gone out to business owners, and additional notifications will be going out the remainder of this week. The initial round of funding totaled more than $10 million, with grants ranging from $5,000 to $25,000. I can tell you, as of this morning, we had almost half of those back already with signed contracts and W-9s, and now in the process of getting their checks. Eligible applicants that do not receive a notification this week will be considered for potential funding rounds in the future, but a new application will not be opened. I do encourage, however, that all Iowa business owners that have been impacted by COVID-19 to visit iowabusinessrecovery.com for information about all programs and resources that we may or other agencies will have available that touch on business relief. So with that, thank you very much.
Thank you, Debbie. And I want to thank the Iowa Economic Development Authority and the Iowa Department of Revenue for their effort, for the effort that your teams have put forth to help Iowans at this time. You know, there is absolutely no playbook for the situation that we're in right now, but your willingness to develop solutions that will provide relief until we get things back up and running is making a difference for so many Iowa businesses and families during this time. So again, just a heartfelt thank you to all that you've done. So yesterday, I did also provide additional information about some of the data that we are tracking to ensure that our hospitals have the resources they need to care for Iowans. And as our number of positive COVID cases continue to increase, so as I mentioned, 6 regional medical coordination centers, or RMCCs is how you'll hear us refer to them, have been established by the Iowa National Guard to support the Iowa Department of Public Health and our Iowa Healthcare coalitions. The RMCCs help facilitate communication, critical information sharing, and coordination of healthcare resources within a region or across the state as needed. Today, I want to take a look at 2 additional regions and provide a snapshot of hospital resources that are currently in use for COVID-19 patients and the resources available to care for others. So we'll start with Region 1. The RMCC Region 1 is located in the central and south central part of the state, and it includes the Des Moines metro area. So as of yesterday, there were 33 COVID-19 patients hospitalized in Region 1. No new patients were admitted in the last 24 hours. They have 11 in the ICUs and 6 were on ventilators. At the same time, there were 1,433 inpatient beds available, 179 ICU beds, and 221 ventilators available and ready for patient care. In RMCC Region Number 2, which covers central and north central part of the state, they have 2 COVID-19 patients that were hospitalized in Region 2 yesterday. No new patients were admitted in the last 24 hours. 1 patient was being cared for in an ICU, and 1 was on a ventilator. During that same time frame, there were 231 inpatient beds available, 11 ICU beds, and 26 ventilators available in Region 2 hospitals. Just as we saw yesterday, patient volume is manageable and resources are in good supply at this time. You may have noticed that the number of beds and ventilators is significantly less in Region 2 compared to the other RMCC regions. North Central Iowa has a much smaller population. The hospitals in those counties are smaller, and they have fewer resources than hospitals in more of our urban areas of the state. But if a facility in Region 2 experiences an increase in COVID-19 patients and needs medical equipment, the RMCC will facilitate getting it to them. In addition, if a patient in Region 2 community needs a higher level of care, that's what is available locally, they can be transported to another hospital either in the same region or elsewhere in the state. And this is the purpose of really establishing the RMCC model now so that we are ready to respond to any situation that may unfold. Again, I want to thank the Iowa National Guard, the Iowa Department of Public Health, the Homeland Security and the local public health officials, and Iowa's healthcare coalition partners for working together as one system of care. As I've said multiple times, we are in this together, and I greatly appreciate everything that they are doing to make sure that, first of all, everything that we're doing is to prevent overwhelming our hospital facilities and to protect our healthcare workers and to protect the most vulnerable, but also that we are prepared in the case that we start to see an increase in the numbers. So with that, we'll open it up for questions.
So I wanted to understand the spending on the business grant program. So is it correct that the first round of funding just went out the door last night, as you said? And so you're expanding the program from 4 million to 24 million, and I believe that's through the authority that the legislature gave you when they
Right.
suspended. Are there other, have you used any of your other authorities for other spending purposes? And then I also want to understand how the federal money is going to come in, because we're expecting that.
So we have not yet. So as we had indicated earlier, we wanted to make sure that we had all of the guidelines from the CARES Act so that we knew that we were using our money appropriately until we could have it be either backfilled or supplemented through mission by the CARES Act. I was not able to get on, but my chief of staff was able to set on a call this morning with Secretary Mnuchin. Iowa will be getting $1.25 billion in a block grant. They are anticipating the rules and the guidance for that coming out next week. I think one of the things that the governors have continually asked for, and I think was relayed on the phone call this morning, is the flexibility to really, as long as it's tied to COVID, but to be able to, I could go to the Legislative Council, ask for additional transfer of funds, knowing that as the money comes in from the CARES Act, we'll be able to apply that toward the money that we were able to get to more businesses in a timely manner. So we'll have better guidance on that next week, but I fully anticipate they are trying to be as flexible as possible, and if we have the resources to go ahead and work with the Economic Development Authority and their team for that that stopgap until they're able also to go online and apply through the small business SBA for some of the loan opportunities that are there. And I don't know, Debbie, do you have anything you want to add to that?
Let me just, so let me clarify that last night, the applications that we sent out, the 503, I think exactly, was totaled over a little bit over $10 million, right? So there will be another tranche going out today and probably another one the following day until we hit that $24 million cap.
So Debbie, the total they've asked for is 148, so clearly
Right.
we have that, so 24 is the cutoff for us.
For right now, until we can better understand what's available through the CARES Act and how we can utilize that, but again, in conjunction with the SBA and other loans that they have available to some of the businesses too.
And Governor, you gave out the new numbers for Region 1, that's most important to most of our review account. So how encouraged are you by those numbers? What do you want to tell Iowans about hospitals? Are they prepared and do you feel comfortable that we're ready for whatever might come down?
Yeah. I really appreciate the data and the information that's being supplied to our team from the RMCC. So we really are able to track on a daily basis the number of beds being utilized, the number of ventilators that we have, and we can, put that into the projections as we look at the peak. We are always preparing for the worst, but I am somewhat optimistic. We still haven't peaked yet. We're anticipating that at the end of this month. But again, only 10% are hospitalized right now, so that's a fairly good number. And I think the number that gives us a lot of hope is that the 38% of all positive cases have recovered. And so what we have seen over the last 7 to 9 days is our positive cases have been pretty stagnant. So they've stayed pretty much the same over the 7 to 9 days, and that's really what has been our goal, is to really flatten that curve, not overwhelm our healthcare systems, while doing everything that we can to protect our most vulnerable Iowans by every single Iowan doing what they can do, and that is stay home, reduce your trips to just essential services, whether that's to go to the doctor for groceries or to pick up medicine. Exercise, for heaven's sakes, get out there, but do it responsibly. Practice social distancing. Do not gather in groups of more than 10. And if you are sick, isolate yourself and stay home. And if we see that, and we're seeing some of the reflection of that, hopefully we'll start to turn the corner and we can start talking about how we dial back up the economy.
Governor, do you have any more specificity as to when that peak will come? And if the state is still working on developing its own projection model, what data is going into how you're projecting that?
Yeah. Do you want to take that, sir? Let's see, I'll go this way.
So thank you for the question. We do continue our work with the University of Iowa in terms of analyzing the data. One of the things that I think we all recognize, and we've talked about it at these press conferences, is that some of the projections will be difficult to make because we have had a limited number of tests and limited number of testing capacity, and that is something that we continue to work on every single day in terms of trying to increase testing capacity in the state. So we are actively working with the University of Iowa College of Public Health to develop those models. But I think to the governor's point, the most important thing that we can be doing right now is to prepare. And so to flatten that curve as much as possible, to understand what our resources are, to understand what the plans are. Should we start to see increased hospitalizations in a particular area of our state. And so we're very focused on that. We're doing that every single day. And we just continue to ask Iowans if they continue to do the things that the governor has asked them to do, that public health has asked them to do. I think that we'll be in good shape here. Thank you.
Is it safe to say that we have enough ventilators now, we have enough beds, we have enough PPE, or are you still looking for more of that?
The PPE shortages are real. We continue to look for PPE from all different avenues. The Department of Public Health, in conjunction with the Department of Administrative Services and all of our other state agencies, and there have been manufacturing facilities in Iowa that are looking to help increase the supply of PPE in our state. So I think we feel pretty good from a resource standpoint in terms of beds and ventilators at this particular point in time based on what we're seeing. But again, critical to all of this is it really is important for all Iowans to continue to stay home, leave only for essentials. That's the way that we're going to slow the spread of the virus in our state and make sure that our hospitals and our health systems have the capacity to deal with patients who do become more seriously ill.
And I'll just put one more finer point on that. That is how we really protect our healthcare workers and our first responders and our essential workforce that's out there standing on the front line every single day taking care of Iowans. So the more that every Iowan does their part by really being responsible, you are helping save lives and you are helping protect our healthcare workers that are taking care of those most vulnerable Iowans that are in the hospital. And so continue doing what you're doing. I know Iowans are, but for those few that maybe aren't, do your part. We can do it, and together we can get through this. And we can, honestly, these press conferences, we can talk about dialing things back up, and I know that's where people want to be. So we want to do it in a responsible manner because we don't want to see another surge. But if we do what you need to do now, we'll get there sooner rather than later.
Rod Beauchard, the Cedar Rapids Gazette. Go ahead. Rod, are you there?
Yes, Governor, I wanted to ask, with the nice weather and limited outdoor options, we're hearing reports of crowded trails for hiking, running, and biking where it's difficult to manage social distancing of at least 6 feet apart. And the problem is such that some local officials are considering closing the trails to the public temporarily until you hit the COVID curve flattening in the state's peak period. Is it on the radar at the state level to consider closing those trails or otherwise expanding closures of outdoor recreation space?
I hope not, because we need that. We need that for our mental well-being. We need that for our kids and our families to get the exercise and to get outdoors. So practice social distancing of 6 feet. Kevin and I went for a walk on Sunday. We came across somebody. We both split on the sidewalk and practiced our social distancing of 6 feet. But the other, option is to take a mask with you. So if that becomes a problem, then you're protected that way as well. So we're trying to be, responsible and resourceful while always mindful of the need of the PPE. And so they scarf, mask, whatever that may be as a secondary practice, but first and foremost, you need to practice the social distancing of 6 feet as much as you can.
Caroline, go ahead.
Governor, I have a question about the notion of staying home and also not gathering groups of 10. Can you clarify that, you know, the groups of 10 seems in conflict with staying home, because we've seen that people could say that, oh, you know, a group of fewer than 10 people can come to my house for dinner parties so long as it's, you know, 10 or less. Can you clarify?
Yeah, I wouldn't do that, Caroline.
Doing something like that.
Yeah, I wouldn't do that if I were you. I'm not suggesting that, but we have put out an order that you can't socially gather in groups of more than 10. Be responsible. I think the first thing I say is stay at home. You know, that's how you limit exposure, and that's how you limit exposing other ones. Everybody has to be responsible when they're making those decisions. So, you know, we're going to get together this Sunday for Easter via Zoom. You know, I'm going to have to cook my turkey, our 3 daughters, our turkey ham. I mean, so, you know, we're using social media to connect, but, you know, we're not getting together with my family either, because we need to do everything we can to stay at home, limit going out except for essential services, and if we do this, we'll get through this sooner rather than later.
David Pitt, go ahead.
Yes, Governor, thank you. We noticed a 17% jump in hospitalizations in the last day or so, and I wonder if that increase is telling us anything about the severity or anything.
Do you want to talk about that? Yeah.
That might suggest data-wise that we should be aware of.
Okay, I'll let Sarah talk to you about that.
Yeah, thank you. Actually, what you're seeing in terms of the hospitalization data is a difference in the way that that data is being collected. And so previously we had been asking local public health agencies to follow up with patients to determine hospitalization status. Over the course of the weekend, we put out a new mandatory reporting order, and we're asking hospitals to report that information to us directly. The intent of that is really so that we have a more timely information about our number of hospitalized patients. Previously, some of them were still pending investigation by local public health agencies, and so we also wanted to have more timely understanding of what our hospitalization rates were. And you heard the governor mention earlier that we have about 10% of our total cases that are hospitalized at this particular point in time. And I think that is consistent and actually maybe a little bit lower than what we've seen nationally with a 15 to 20% general hospitalization rate. So but what you're seeing is not necessarily a jump in hospitalizations overnight, for example. It's just more timely reporting, so we have a better, more accurate picture of what our current hospitalization rate is.
Next question, Rachel at Channel 5.
Hi, Governor. Your team, 2 questions. Your team told me yesterday independent living facilities aren't monitored in the same way as long-term care facilities. Can you explain why that is? And then also, 3 employees at the Veterans Home in Marshalltown have tested positive for COVID-19. What is the state doing to respond to this location, and do you consider this an outbreak?
Yeah, at the Iowa Veterans Home, was that the question? I'll go ahead and answer that, and then I'll have Sarah talk about independent living and long-term care facilities. Actually, the Commandant has been very proactive in educating the staff and the facility based on the Department of Public Health guidelines. They restricted visitors, I think, March 15th is when they started doing that, if not sooner than that. All the staff is screened for respiratory systems. They take a temperature scan when they're coming and leaving. Anybody that has tested positive and anybody that they've come in contact with, they are testing outside of the facility with a drive-up test. So, and they are keeping them isolated until they get the test back to find out whether they're positive or negative. As of today, today, they have had 25 tested, 19 negative, 3 positive, 3 pending. They have tested 25 residents, and they have 0 that are positive. The staff member that was tested positive on the 26th had no contact with any of the residents. The staff that was tested positive on the 27th, the last day of work was the 17th of March. She was a direct care provider, but so they have been able to test anybody that she had come in contact with. And then again, the last one, the last day of work was March 29th. They also made sure that those that they had been in contact with knew it and were watching for symptoms and were being tested if they saw any symptoms. Also, all direct care staff are expected to wear surgical masks and face shields at all times when they're dealing with the residents. And the non-direct care providers are required to use homemade masks, and if they would like a shield, those are being provided as well. So I will ask Sarah then to talk about the long-term care.
Yeah, thank you. So one of the things we know about this virus is that it spreads very quickly in situations where people have close contact with one another. And so when we talk about long-term care outbreaks, we're talking about long-term care facilities where we have a number of patients that are living very closely together, which we distinguish from an independent living facility where residents might have their own apartments. And so, it's not that we don't follow up and provide guidance and assistance to independent living facilities or assisted living facilities. But when we're reporting a long-term care facility outbreak, it's more in terms of your traditional nursing home where we have a number of patients that are living in close quarters with one another. And so because we know this virus is so contagious, when people are in close quarters like that, that's what we're referring to when we say that we have an outbreak in a long-term care facility. So it doesn't mean that public health isn't doing everything that we would normally do in terms of contacting patients and contacting people that they may have been in close contact with, like members of their immediate household if they are living in more of an independent living facility type situation. But when we talk about long-term care outbreaks, it's really more your traditional nursing homes. As the other thing we've seen about this virus is a quarter of our cases in Iowa, they're within a household unit, within a family unit. So where we have a particular member of a household that's been identified as a positive case, a quarter of our cases have been in contact with people that they're living with. And so that's the other reason why we provide guidance that if you do have a positive test result within your household, those people really need to isolate themselves. And we provide the same guidance to long-term care facilities that I walked through previously. If we have ill residents, they really need to be segregated from the rest of the population because we do know this virus spreads very quickly in congregate living situations.
Clark Kaufman, Iowa Capitol Dispatch.
Thank you, Governor. 10 days ago, a federal judge ordered a wide array of reforms, 3 years of oversight at Boys State Training School, saying the state had basically tortured the children in that facility and had shown deliberate indifference to the harm it was causing. Can you tell me what your response is to those findings, and also talk a little bit about the testing that's taking place at that facility and whether or not anyone has tested positive?
Yeah, so I think that case goes back to 2017, if not prior to that. And we are, it's unconscionable. We are working with the Attorney General to talk about what next steps are. I want to thank Director Garcia for the steps that she has already taken and will continue to take to make sure that we get the situation resolved at the home. And she continues to be on the grounds and working with the staff and working with the Attorney General and the legal team as to what we do moving forward. I'm not sure. I'd have to get back to you on how they're testing there so we can follow up with an answer to that. I'm not sure what steps that they have taken, so I can follow up with an answer to that. But we will continue to work with the Attorney General for next steps. And again, I want to just say thank you to Director Garcia for the steps that she has taken to correct the previous actions.
We're going to do 2 more questions. Adam at KCRG.
Hi, Governor. I had 2 questions, both around long-term care facilities.
Okay.
As Dr. Badani mentioned, those are of high concern just given the close living quarters and how contagious these coronavirus cases are. Why not identify the long-term care facilities that have had 1 case, like Minnesota has done, so there doesn't appear to be any HIPAA concerns with doing so? And then on the second part of that, is there an effort to do testing of asymptomatic residents at these homes that have had 1 case, or are there any other steps being taken to kind of get ahead of a potential outbreak and stop 1 case from becoming many?
Well, I can tell you that they have been very proactive because we have over 444 long-term care facilities in the state of Iowa, and we identified very early on, before a lot of the other states, that that was a really potential risk for us because that's where some of our most vulnerable Iowans were at with underlying conditions. So working with the association and the providers all across the state, they have been very proactive in eliminating visitors, entrance in and out, screening their staff, and working very diligently to make sure that they have the PPE that they need while they are serving some of our most vulnerable Iowans. So they have been very proactive in doing, taking every effort that they can to protect those Iowans. And I'm going to have Sarah talk about the testing.
Yeah, so certainly we define an outbreak as evidence of transmission within a facility of the virus. And so that's why if we would have a single case, we wouldn't necessarily consider that to be an outbreak until we had evidence that transmission of the virus was actually occurring within the facility. And so I kind of outlined all of the things that we have been asking long-term care facilities to do when they do have a positive case identified in their particular facility. And that includes, screening all patients for fever and cough or breathing problems daily. We've also advised for the use of PPE with all patient interactions within a long-term care facility. And that really is because our goal is to prevent the spread of the infection within those particular facilities. And so if we can do that, then we wouldn't consider there to be an outbreak in the facility. But once we get to 3 or more confirmed cases, that's the standard that we're using to determine that we do have an outbreak in the facility.
Price, last question, go ahead.
Good morning, everyone. Governor was on about an hour or so ago. Des Moines schools announced the plans to do distance learning beyond the suggested April 30th that you've already advised they will do it for the rest of the year.
Okay.
At this point, can you tell the remaining districts when you think you will decide whether you will have to take the step to recommend shutting down schools for the rest of the year for everybody's safety? And then along with that, what role do you see that the state will play, if any, to help families who don't currently have the ability at home to do this laptop or iPad-based learning so that they don't fall further behind?
Yeah, Dave, thank you for that question. I appreciate that very much. As we've made all of the decisions that I've made, especially when it came to recommending closing of our schools, to extending and mandating the closure through through April 30th, with the requirements that they either do voluntary or required continuous learning, and they need to sign up through April 10th, and if they do either one or a hybrid, that we would waive the hours through April 30th. But I also told the school districts, I jumped on a large conference call afterwards, that I know it's important for them when they're trying to make decisions. So within 2 weeks prior to the 30th, we will sit down with the team and with the Department of Public Health and the experts that we've been working with, take a look at where we're at, and I would give them somewhat of a heads up 2 weeks in advance so we could kind of see which direction we thought that we needed to go moving forward with this. So I think that's about another, I'm losing track of time, but I think it's about another week. We'll sit down, look at the data, and then kind of give them some idea of where which direction we're recommending that they go. So, and the other thing that we have asked from all of them is that if there's things that you need, whether it's maybe you don't have the broadband capacity or it's laptops or whatever that may be, to also let the Department of Education know. I think they've got a website, or they're in constant communication with Director Lebo. If there are things that you need that's preventing you from providing that education for your students, to let us know, and we'll see what we can do. There's been a lot of businesses that have been very generous in helping provide laptops, or just we've talked about trying to provide hotspots through buses. So there's a lot of different things that we're looking at. People are being very creative and innovative, and we want to make sure that we're providing continuous education to our students. It's extremely important, and the state will have a role to play in that as well. So thank you.
Clear?